Now we're going to talk about neurology. And neuro is one of those things that has a very wide base of things you have to look at as far as what happens to patients. Because you see things not only that happen with the central nervous system, you have peripheral nervous system problems, you have things that affect mood, you have things that affect movement. So there's a lot of different things when you're looking at neurologic symptoms, where you have patients or things that present in the hospital that have problems. Now they have a lot of things listed on chronic neural problems for your content areas, as far as kind of things that are going to be that you might be tested on. And I will tell you the ones that are yada yada first, but I don't ask you about them because nobody goes to the hospital for this. Okay, and mainly that's because in the whole grand scheme of things, when you're looking at your NCLEX test plan, what they're going to use are the common things that you see. They actually go and ask nurses what are going to be those things that are going to help me be successful in my first year of working as a nurse. So the assessment of a neurologic patient is going to be important. So look at that part in your textbook that talks about how you assess neurologic function. You know, that's the Glasgow Coma scale. That's how you go in and see whether or not a person has movement, strength, those types of things. Because what's really important is just because a person can move and do all this stuff does not tell me I have strength. So you always have to test that in patients. So looking at pupil response, looking at how alert they are, is their speech clear, all those types of things, are they sitting upright? A lot of those things are going into making that neurologic assessment on your patient without even taking out a piece of paper and going like, oh, am I checking off everything that goes along? If a person can sit upright, that's a big deal. They're not drifted over to one side, because that's what usually happens when cerebellar function is affected. You got somebody drifting to one side, and they're usually doing the opposite side of where they have something going on. You're looking at pupil response to see whether or not the pupils are actually responding. Remember, you flash one side one time here, look here, you flash the second time, look on the opposite side. Pupils react concentrically, so they should be reacting on both sides. And you get a better look when you're doing one here, look here, one here, look there. And then you do it on the opposite side when you're doing that with your patients. Okay. If you really got somebody having something going on with their head, you do all of those things. Those 12 cranial nerves that nobody ever remembers. Because people have all kinds of things. Usually the nasty stuff is what y'all remember. So there's all different kinds of stages. There's on Olympus, power and tops, that's some you'll hear. And then you'll hear other things that talk about them. But usually students remember the ones that are not quite so nice. You can see everywhere. Okay, so you'll learn different things as you go along. But if you're somebody that comes in that had a stroke, somebody who had a carotid endarterectomy, you know, that's where they're going and clean out the carotid artery. So you think this person has a TIA or whatever it is this person has, 12 cranial nerves are important. So not that you have to remember all 12 of them at the same, because you're going like, oh my God, Ms. Emerson, they're going to be on the test, I got to remember all 12. That's not what I'm saying. When you're going in and looking at your patient, if you can talk to your patient and the patient is responding to you, that's actually testing one of the cranial nerves. So it's not like you got to go like, okay, did I check it off? Yeah, you did acoustic because the person is talking to you. Okay. So you are doing that. When you're doing eye movement, it's all this going around. 2, 3, and 4 have to do with pupil response and also whether or not you see them doing the spokes in the wheel. You know, when you go to the doctor and he does this to you, tell you, follow my finger. They're actually doing cranial nerve testing. They don't want you to move your head. Okay, so if a person is moving their head, it's because they can't see it. So that tells you something is going on there. Okay. If you go to this side of the room and the patient says, I can't see you, and then you turn and have to see you, that they've lost the visual field. Those are things that happen with a stroke. So those are things when you're doing your neurologic assessment, those are things you're doing. The last thing they do is always bring the finger to your nose because they're looking at accommodation because you should converge. Okay. You should look cross-eyed for a second. That's what they're looking for. If that doesn't happen, we know something is happening with the patient. So those are things you're doing that are part of the neuro assessment that you're doing with the patient. So if you have somebody that does that, also have them smile, because you can pick up when a person has some weakness on one side. The smile doesn't go over the whole face. You actually see a facial droop. Sometimes you won't see the droop when a person is talking to you, but if they smile, you see it. That's why it's important to do those things. Have them clench their teeth. Maybe they can stick their tongue in there. Maybe you have just Do that on either side. Put your hand up there when they do that. So they're like pressing against your finger. You're testing the hypoglossal. So you can see whether or not they can hold their tongue against your hand. That's strength, because if you see it there, but then you tell them to push against it and they can't, that tells you there's some weakness there. That means that's somebody who can aspirate. Those are things that's simple that you can do to figure out what's happening with your patient. Clench, smile, shrug your shoulders. When you do shrug your shoulders, that's 12. That's the last one. So when a patient can do that, and if you're worried about whether there's some strength issue, put your hands on top of their shoulders and see if they do it evenly, or they can shrug against you pushing down against them. Smelling, just bring something in there that somebody not that, I told y'all about using those, ammonia, not that. Bring something that has a strong odor that people know. Orange juice, coffee, something like that. You're trying to tell somebody has that olfactory is working. So you've done all of the things you need to do. Now when they get into doing more stuff, now doctors get into doing more things. Because if you got a person that you're worried about how their hearing is, that's when you got to tune it for. Hit it on something, put it on top of their head. Hearing should, and that should be lateral on both sides. So people should hear ringing in both ears to the same amount of time. When they don't, that means there's conduction, something going on one side. That's how they figure stuff out. It's not people are so smart. It's just